When I get out in nature, I bring a lot of what I'm obsessing about at the time with me initially, and that starts to let go as I walk and as my heart rate goes up and I start to look and engage with my environment, whether it's the desert, whether it's inside of a canyon, whether it's, kind of even in a local park. As I bring myself to those places and those spaces, it helps me to relax, it helps me to de-stress, but then also it gives my brain an opportunity to come to new conclusions or come to new insights rather spontaneously. The brain is an incredible mystery, and how the brain works is an incredible mystery. And so it has just been a really engaging career trying to tease apart how different aspects of the brain work. The Anticonvulsant drug development program has been at the University of Utah for 50 years. We just celebrated our 50th anniversary. And what we've been doing is trying to find novel therapies for the treatment of epilepsy. Epilepsy is probably a lot more common than people know. 1 in 26 people will develop epilepsy at some point in their lifetime. And what is not discussed often is that sometimes, especially in patients or people with epilepsy who don't have their seizures well controlled, is that sometimes they can also pass away from sudden unexplained death in epilepsy. And these are very serious issues and very serious problems. Our preclinical evaluation of many hundreds of potential anti-seizure medications has actually resulted in about 11 anti-seizure medications that have come to the market for the treatment of the person with epilepsy. Every time a new medication is introduced to the marketplace and is FDA approved and hundreds of people now start taking the medication, what we find is that a person who was maybe not was not seizure-free before suddenly becomes seizure-free. So some patients respond very well to these new medications. Being one of the first to know that a compound that's been developed might actually be useful for the treatment of this really devastating disorder is really very energizing and motivating. It allows us to help other people. At the same time, I'm also surrounded by a great group of individuals dedicated to this mission, and people who all take it very seriously. My lab studies the brain, and in particular, how the brain generates seizures following an injury. And when there is a brain injury, we know that seizures can be the result of that, and that can be very disruptive in a person's life. And so we try to understand how to prevent the development of these seizures, and we try to understand the impact of wound healing in the brain and what happens when wound healing in the brain goes awry following an injury. What's been really great about my career here at the University of Utah is that we've been actually able to marry our basic research with our applied research. And what do I mean by that is that a lot of times we will develop a new animal model of epilepsy or a new assay to characterize it in the laboratory, and then we can introduce it into our workflow. And the graduate students and postdocs help us do that. And so that's been very rewarding. So we are able to use our creative basic research to actually improve upon the applied research that we do and hopefully help us get to a place where we can start finding more therapies. It's a source of pride for all of us. It's really impactful, and to know that your work has maybe touched the lives of real people, that's incredibly validating for the science. Rushing around and doing and being in the lab and being at the university is energizing and incredibly, driving, and is really a great way to spend my day. But it can also sometimes induce some stress. Certainly being able to de-stress can help reframe a situation. And so I look to nature to help maybe reframe those difficult obstacles in my life. And so when I'm hiking, or when I'm walking in nature, or I'm hanging out with my little dogs, I can feel my shoulders relax, I can feel the stress kind of going away. It's a sigh of relief.